as far as what are the most common food allergens seen, so there's a lot of differing data in both dogs and cats because dogs are going to be allergic, or cats, or any individual is going to be allergic the more they're exposed to a certain allergen. And so common food proteins that were in diets in the 60s, 70s, 80s, 90s, they're constantly changing. So there used to be much more chicken and beef. Now, we're getting into more kind of exotic proteins like lamb and other proteins. So as these ingredients being used are increasing, there's going to be more allergies to these ingredients seen. So this is the meta-analysis info. So I'm going to go over the meta-analysis data on the most common food allergens. Then we'll look at the most recent individual paper published for the most common food allergens to kind of compare the difference. So if you look at all papers on food allergens from 1967 to 2013, this encompassed 297 food allergic dogs. So actually not that many food allergic dogs if you think about that, how many papers that is and that time span. But this is what was shown. So beef was the most common food allergen in dogs. So 102 out of the 297 dogs in these studies had a beef allergy. So that's 34%, followed by dairy, 17%, chicken, 15%. And then much lower down on the list are wheat, soy, corn, egg, and then other proteins. For cats, similar. Beef was the most common, so 18%. And this was only 78 cats. And this is for over 8 papers from 1967 to 2013. So beef was 18%, so most common food allergen. Then fish, and again, that makes sense, right? Because one of the more common ingredients in cat foods are fish protein. So it makes sense that fish is higher on the list for cats than dogs. So 17% fish, 5% chicken, and then much lower down on the list, the wheat, corn, dairy, lamb, egg. Now, this is the most recent paper. So this isn't a meta-analysis. This is just the most recent papers. So this is probably more accurate to what we're seeing now in our patients. So for dogs, beef, chicken, lamb, pork, dairy, and then way lower down on the list, rice and wheat. Okay, so between beef, chicken, and lamb, you're over 50%, way over 50%. You're at about 75% of food allergic patients. For cats, beef, dairy, and fish are the most common, and for those ingredients, you're at 80% of known cat food allergic patients are allergic to one of those ingredients. These are things that we all know probably, but these are misconceptions for our clients, and I think it's important for us to just be aware of some of those misconceptions. So I just wanted to cover some of these really briefly. One misconception is that grain-free diets are the best diets for pets with allergies. And we don't know if this is due to the low-carb fat in people or due to an increase in gluten-free foods. These are some pictures that were just pulled from Google if you Google grain-free diets and dog food. So what does grain-free even mean? Well, it means it doesn't contain cereal grains, does not mean low-carb. There's a lot of diets being marketed out there that are marketed as grain-free, but they're actually pretty high in carbohydrates. And what about gluten? Gluten is actually a protein composite that's found in many of these grass-related grains. And so gluten disease or gluten intolerance has only been shown once in 1 litter of Irish setters, and that was published in '96. And that family of Irish setters were diagnosed with a celiac-like disease, so an intolerance to gluten. Those dogs had chronic diarrhea, but they had no skin issues at all. And of course, I'm not going to cover too much on the FDA alert. We all know about the FDA alert. This is the Freedom of Information Act FDA as far as the data that they're having as far as DCM cases reported. So, minimum DCA cases up until just recently, and then there was a clear spike in DCM cases reported. These are the brands that have been implicated. As Rain has said, they have not been implicated. They are not on the FDA list, and I have no issues with patients on the grain-free diets, but I know they are adding quinoa to many of their diets. And these are the ingredients in some of these diets. But these are things that have been covered in previous talks given. So the conclusion to me for grain-free at this point is that unless there's a documented allergy to grain, feeding a grain-free diet, especially on that list of implicated brands, doesn't really offer benefit and may be harmful if we're talking about some of the brands that have been implicated. Another trend that I'm seeing in my practice is these raw diets. And the definition of these are diets that include uncooked ingredients derived from domesticated or wild animal species. And these include muscles, internal organs, and bones, unpasteurized milk, and uncooked eggs. And the claims are that eating a raw diet is the way nature intended. But the one that I typically see in my practice is that raw diets cause less allergy and disease for allergic patients. And so as far as do raw diets help allergies, there are absolutely no studies that have documented any benefit for allergies with raw diets. There's actually a thought that raw diets may actually be more allergenic because the proteins are totally intact. So if a patient is allergic to chicken or beef and they're being fed raw chicken or beef protein, they're going to have a strong reaction to that. Whereas if they're being fed a cooked version, cooking or using heat will denature some of those proteins, and it's expected to have a less of a reaction to the denatured protein. So other numerous organizations discourage the use of raw diets, the AVMA, the Canadian VMA, FDA, and others. And so, I do not recommend raw diets due to the possible health risks, not just to the pets, but to their owners as well, and because there's no really evidence-based benefit with raw diets. There's actually another interesting study that was presented. This isn't published yet, but this was presented a few months ago. And this study was a similar study that was done in those over-the-counter diets looking for trace proteins. This was done in raw diets, and this was done in Canada, in Vancouver, actually. And so 9 canine and 9 feline commercial raw meat-based diets were tested for species-specific DNA of animal origin. And so they looked at all these different proteins, so chicken, duck, turkey, pork, rabbit, lamb, beef, salmon, kangaroo, and they ran PCRs on these samples, and they did 2 separate batches of each diet. And the results were that the DNA of one or more unlisted animal species was identified in 89% of the canine diets evaluated, and 61% of the feline diets evaluated. And there was a 78% discrepancy in the canine batches and a 56% discrepancy in the feline batches. And unlisted DNA most frequently detected was lamb in the canine diets and turkey in the feline diets. So based on the possible harm, based on that there's trace ingredients in these anyway, raw diets really should not be recommended for either the diagnosis of adverse food reactions or for those dogs with adverse food reactions to certain ingredients.